Good evening. The news gang is here. 21 days of cessation of movement. But why is the virus not ceasing to move around? We'll take a health check. No free lunch for restaurants. What's on the reopening menu? Also on the show tonight, why Sonko is fighting to undo the deed. On the memo tonight, Jamila is invoking the true Kenyan spirit. The punchline is following the money and the tea at the health ministry. Yvonne is taking on a new brand of whistleblowers. The kicker is drawing lessons from an Ugandan doctor who died fighting Ebola, and the angle is straight towards the city hall that Sonko made. Let's start the show, ladies and gentlemen. 21 more days, Gashuri. How have the last 21 days gone? There's someone who was so angry. He was saying 21 days, kwani sisi ni kuku tulalie mayai.
Interesting, and the first 21 days had all sorts of drama. Very unexpected things happened, and people had to adjust to new life. And the next phase of 21 days, hopefully, will draw from the lessons of the first batch of 21 days. Hopefully, there will be no police brutality. Hopefully, people will behave better than they did in the first 21 days. There will be no party after party and guys trying to hide, taking alcohol in some places, led by some of their leaders, including MCAs and a member of parliament. I hope in these next 21 days, there will be no MP or MCA or any leader who will be arrested trying to lead people into taking alcohol. And thirdly, hopefully, we will now move from a lot of stories to more practical things. Like when we said we can test 35,000 people, let's do that.
Yeah, Yvonne, I was bringing the cuckoo thing because a lot of people seem to have turned this into a light thing, a joke even. I mean, there are lots of jokes that people are making about this thing. And my point here being that, are we seeing this for the seriousness that it should have, or has something changed in the 21 days and now we are kind of going back to normal? I mean, I've seen the traffic jams are back, and people actually can do memes about all of these things as if it's actually something of a joke.
I mean, I think the first 21 days we were all, you know, really arrested of the situation. For lack of a better word, perhaps I should have used a different one.
Seized of the matter, as they say in Parliament.
But it seemed like people then got used to it, especially when you had 10 new cases. You know, we haven't seen 50 new cases being announced in the country. And so I think people are sort of making this the new normal. This is it. Okay. And so people are starting to relax. And I guess that's why today, those of the Ministry of Health during their statement were saying, you know, the worst is probably yet to come. Let's not relax. But I find it interesting to understand what we did in the first 21 days, what worked, what didn't, considering, you know, the only thing, well, the major thing you can do is the non-pharmaceutical interventions, right? Social distancing, lack of movement. But the idea of restricting people's movement is to make sure that then you test them. And in there, you understand a couple of things. One, how the virus is spreading. Two, how the people themselves are responding to the measures that you put in place. And three, whether the measures you put in place are actually adequate and are giving you the results that you desire. I'm not sure what happened in the first 21 days to inform another 21 days. If you take a look at testing, one would have thought that in the 4 counties, and there are now 5, once Mandera was added, that there would be some aggressive testing. But if you take a look at it, in the country to date, we've done, what, 20,268 tests in total. And we keep hearing all of these intentions. We have the capacity to test 35,000, but you only see us testing 500, you know, in a day. We've been severely hampered. And I don't know if that is a coordination issue, a funding issue, that we have not been able to get the reagents and the equipment. I mean, the simple one that I think we're struggling is the swabs. And the swabs, for just to simplify the explanation, of course it's a little bit more than that, is literally like an earbud, you know, on a longer stick to collect the samples. And even that sample collection, you know, has been hampered severely. So I'm hoping that we're able to do a little more over the next 21 days to ensure that, you know, the restriction of movement was actually worth it. Or else then, you know, we're just at that point. And it's just to point out, a country like Uganda did 2,400 tests on Tuesday alone. We are testing a quarter of that on a daily
Ghana?
basis. Yeah, Ghana is doing, you know, I think up to 1,000, if not more, in one day. We're testing 500, 700, 800, yeah.
I think, Joe, something Yvonne has mentioned comes to mind in terms of now this 21 days. What was different the first 21 days and what we are seeing now is, for instance, now there are places which are becoming hotspots that are not hotspots before during the first 21 days, namely Mombasa, and now Kawangware today has about 14 cases of infections after. In the past few days, the number has really grown up to 14, and the ministry has said that they're going to start mass testing in Kawangware tomorrow. Now, the CIS himself, Rashid Aman, spoke about the worry that they have in places like Kawangware, which have huge populations, and people are going about their lives as usual. Yesterday, Stephen Leto was in Kawangware, and I remember when I watched the story and he was doing his piece to camera, there was a huge crowd of people around him, and it looked like a normal kawaida day when you'd go when there's no COVID-19. That's one that is worrying the ministry in terms of now having to test people in that area. Two, Mombasa. Today, there was mass testing in Old Town. Old Town is one of the places in Mombasa that is recording huge numbers of infections. As of today, there are 23 cases in Old Town. And then the turnout was very low today at the coast. And one of the reasons that was being given is that people don't really want to know their status. Hawataki kujua kama wako na corona au hawana. I heard one of the residents of that area saying that he's just hearing in the news that Old Town has 23 cases of infections, while he has not seen any person that he knows who has it. And then speaking to the county commissioner, who's the co-chair of the committee that is leading the coronavirus fight at the coast, he said there are three reasons why Old Town could be becoming a hotspot now for the infections. He says, one, there is a gentleman who came from Dubai, and he had the virus, and he went and he spent time in the community. And two, they say there's a doctor also who got infected and also spent time with the community. And three, the way people live in that area is very communal. People eat together in one plate. People sit together, barazani, kijiweni. They spend a lot of time together. So it's really difficult to maintain social distancing. And number four, there is a traditional doctor who also passed away from COVID-19, and he was seeing patients. So they're saying all these factors have contributed to the fact that Old Town now is starting to see a rise in infection. So these factors were not there in the first 21 days that we had. And now we have this new things coming up, including the infection in Wajir. Somebody who was at the border coming from Somalia with 3 others, he was found to be positive. And because of that, the border town of Dif has been closed starting this Sunday to try and just control the spread. So there are a lot of these other new things that have come between the last 21 days and this one. And finally, Joe, we need to, I think one of the things that needs to be done in these 21 days is to tighten the controls along the borders and also along the cities. For example, we had the people who are said to have escaped quarantine in KMTC, and they were in Kericho the next day. So how did they pass all the way mpaka wakafika huko? We need to tighten, we need to put restrictions at those points where people wanapita panya route na kuelekea kwingine.
Yes, Kai. 21 more days.
21 more days, and the question is 21 more days for who? Because it's time to ask questions about the application of these restrictions and the desired outcomes. Because I don't think sufficient questions are being asked about those days. Just saying, okay, extended for 21 days. One thing the government has done very well so far is the curfew. It's 7 p.m. It's 7 p.m., so people are actually off the streets. But the question must now be asked, how much of that gain is lost during the day? Because if what Jamila has just mentioned applies here, if the behavior is not changed, then really it's not about day and night, it's really about behavior change across the 24 hours. And I don't think we are achieving much in terms of behavior change. It's very worrying to see how quickly Kenyans are starting to go back to normal. Jamila, you had the sound bites from Kawangware. Somebody said, no, I don't have a mask. And another said, I have a mask, but yeah, I will wear if somebody wants me to do that. Amanelisahau. This is typical Kenyan behavior. And if you remember the implementation of the Matatu return to sanity rules by John Michuki, simple things like tie your safety belt. It's not for the government, it's yours. Simple things like there was a time the government was requiring motorcycles
to wear helmets.
To wear motorcycles riders to wear helmets. Do we have those helmets? We don't. We don't have helmets. So if you cannot implement a requirement on helmets, then even the mask will be a very, very difficult thing to implement. So I think we've had 21 days of an attempt by Kenyans to change behavior. And there's something else that I need to point out here. Kenyans seem to only respond to shocking developments. Mm-hmm. If there were deaths in the standard of New York or Italy, you will see people not just wearing masks, but they'll wear those white gumboots. They can even wear the PPEs down to the slum because they can see the danger. The problem right now is there's some attitude going on in the public that seems to think that the wave has passed. Mm-hmm. That this is not normal. It's just a normal thing. It doesn't kill like we were told. Yet if you look at these numbers and the patterns in other places like Italy and New York, it actually took time. The build-up was this slow. They also joked about it for about 2 months before it eventually struck. And I'm saying this just hoping that it can go that direction in our country.
Yeah, I think there's been an interesting set of things that I've seen during this period. One, of course, has to do with the enforcement, as Jamila was saying, where you are not too sure whether the police have mapped all the possible panya routes. And someone was saying that some of the police officers actually know those panya routes and either look the other way, or some of them even encourage people like, you know, if you want, just go this way, because obviously they are police officers like those ones. But I think for me, a deeper question that is beginning to form in my head right now as we go into this next 21 days is this. Have we figured out something that we can say is uniquely our own approach to this, given our socio-economic conditions that may be quite different from what we are seeing in other countries? Because we have seen countries trying to sort of develop their own models that sort of borrow from the international standards of hygiene and all of these things, but very deliberately taking into account the context, the social context, the economic context of those particular countries. I'm thinking, for instance, and Yvonne spoke about this a couple of weeks ago, where you have informal settlements where people literally live next to each other, so that even when you get out of your door and the other person gets out of the door, you're not even doing the 1 meter that they've been talking about. Is there anything that is being done to kind of compensate for that? That fine, these people are always going to live this close to each other. Is there another intervention that we are putting in place to make sure that this risk that is here is mitigated elsewhere? Because I think that should be the kind of thing that is exercising the minds of the professionals that we have here, to see what is this thing that truly applies in Kenya in an effective way, considering the fact that we cannot have the kind of lockdowns that we've seen in other countries. I mean, in the US, they've been telling us every week about, 30 million people have filed for unemployment, which essentially just says, you go to the government and say, you know what, I used to have a job, now I don't have a job, please take care of me. That is what it is. Here, people have always not had jobs, so you're not going to say, I have lost my job, therefore help me. I mean, there are people who have lived for 50 years in this country and they've never had a job, and the government has not helped them, because that's where we are economically. So how is it that we can create this thing that is just ours, that is not based on the cut and paste sort of approach that we have seen happening in many sectors? I think that is going to be the big question for us going forward. Even the economic cost of some of the measures that we've taken. Is there anyone who's saying, this is how much these shutdowns are costing us, and therefore, based on our assessment of the risk, it is worth that risk? Because without testing, as we were saying, you don't know how many people have this thing, you don't know the rate of spread and that sort of thing. So you really don't even know what risk trade-off you're doing. Because risk trade-off works when you know you can figure out what that risk is and the possible return. And then you kind of do a trade-off and say, you know what, we can take this risk because this is what we are losing in turn, or we can avoid that risk and whatever. So there are all these things that I think are going to come into play. Francis, the question that I think many Kenyans are asking, so what after these 21 days that we are going through? Is there anything to suggest that we know what is going to happen, or we'll come back and say, we have another 21 days? Because there would have been a conversation like, within these 21 days, this is what we are doing to make sure that when the 21 days are over, maybe we might begin to see some things opening.
I look at it this way. As long as the number of infections continue to increase, the possibility of an extension of another 21-day kind of a scenario is always in the air. And hopefully, there will be a better way of spending these 21 days. First, to know as many people as possible what is their status in terms of COVID-19. And number two, the specific intervention measures. Because initially, there was this story that this is a disease of guys who are coming from outside the country. People are no longer coming out of the country, so it is within us now. There was always the fear of community infections, and especially in the informal sector. We are already there now, because when you talk about Kawangware, it's a heavily populated area, Pray that the situation does not arise in Mathare, in Mukuru, in Korogosho, and other areas that are heavily populated, even Kibra. So that is one of the profound risks that we face. Number two, now more measures, more targeted and specific measures for certain areas, because one size will not fit all. So let's say in this informal sector, these are the specific interventions. If it is in the urban areas that are not necessarily informal, what you call estates and so on and so forth, what are the mitigating measures? Because look, almost every place now has infections. And back in the villages, you hear people say, hii kitu ni watu wa Nairobi. It is going even to the villages. So there is need for specific measures. And now, at this point, much as we are looking at the national government, we should also be looking at the county governments. Because what are they specifically doing? Are they being facilitated well enough? Do they have enough resources to ensure that in the event this erupts in the specific counties, then they're able to deal with the situation? Otherwise, we will be focusing so much on what the national government is doing as opposed to what is being done across the country.
I just want to add to the unique approaches that everybody is talking about, and particularly when we take a look at Nairobi and Mombasa. I mean, for people who come from Mombasa, you understand the culture and the society there works very differently from, say, Nairobi. It's very communal. There's a great sense of togetherness. People eat together. It's very different from Nairobi, which is typical city. Eh? You get into your house, even if it's your small one-bedroom house, you mind your business in there. Mombasa is completely different. And consider that now we're in the month of Ramadan, where it's the spirit of sharing and coming together and sharing a meal. And so even those unique approaches, I think, need to be adopted. What you do in Nairobi cannot be the same as what you do in Mombasa. And I think Mombasa really needs to be
even the
taken
different
seriously.
Parts of Nairobi and the
Are not the
demographics and the behavior. I mean, how people behave in Kawangware, they are definitely more communal than some of these sort of
Kawangware is, an area that has a population of maybe 150,000 people or more. Most of whom are children and young adults. So even as we're talking about mass testing that's to begin there tomorrow, and I think we need to be careful about the use of the word mass testing. They're not going to test over 150,000 people. It's going to be targeted, and I think it's important for them to explain to us, who do you test and why? Those are some of the things. The thing about testing, we cannot overemphasize what needs to happen over the next 21 days in these now 5 counties. You've got to test. You've got to understand what is happening here, isolate them, give them treatment. Really, when you think about it, testing is the only big tool you have, because the rest is really asking people to stay home, wash your hands. I mean, when you think about it, we're in a phase where testing is just, is it? Because we don't have any form of treatment that's been agreed upon. There is no vaccine. There is obviously no cure. This is a viral disease. So what do you need? You need to understand who is where doing what. In case you're thinking, well, the numbers are, 10, 5, 8. Take a look at this. At the start of this month, at the start of April, we had 81 confirmed cases. 30 days later, the number of confirmed cases has grown 3 times to 384. So in as much as it may seem 10, 5, 9, 12,
cumulatively the numbers are increasing.
Cumulatively, it increases over a month. The numbers have gone up threefold. Yes.
Yeah.
It's actually
So, I mean,
and actually, just to give a sense, the cases in Kawangware, it actually started with one person. I mean, just talking to all the people who are involved here, it started with one patient who works in, I think, one of the international organizations, but lives in that community, who then sort of passed it on to almost the entire family. And so you could trace like 5 people from this one person, and out of the 5, one of them had like 7 contacts. So within a very short space, this one case that was there, you're actually now looking at 13 people traced to this one person. And one of the things, the glimmer of hope that they were still saying that, at least we still have cases that we can account for. That's what they call local transmission, where you can say Yvonne interacted with Jamila, who then interacted with Gashuri. But there's a point at which you lose track because you can't quite trace where this person got it from, where you're now talking about community transmission. People are transmitting it randomly, so you don't know who it is. So what kind of challenge does that really pose, Jamila? Because it looks to me like the longer we wait before we do this testing, we're talking about tracing, testing, and isolating and treating, as they've been telling us, the more difficult it really is going to be.
That's true, Joe, because we're doing community transmission. It's been said even by the ministers whenever they're giving the press briefing. And you speak about Kawangware, and it's the same instance in Dandora. Remember, there was one lady who was asymptomatic. She had no symptoms. In fact, she went to the hospital because she has a pre-existing condition, and she had gone for a normal checkup. And then when she had a slight temperature and they tested her, that's when they found that she had the virus. And she had spread it to members of her family who had interacted with others. And in fact, contract tracing for that is still going on, Joe. And the longer we let this go, especially in such communities where people live in small spaces and they interact with each other, the longer, the more worrying this situation will be in terms of the spread of the virus. And I think something else we need to look at, and we're going to discuss it also, and Yvonne alluded to it, I think her explainer was about it, is now this issue of the hotels and the fact that now there are conditions which have been set for them to be opened. And when we went to do a story about it yesterday in Kawangware, we had those small vibandas which were operating as normal. There was nothing about testing or takeaway or the waiter who's serving you to be checked tables. Between 1.5 meters, or we open at 5 a.m. and close at 4 p.m. Those did not matter. There people are going on kama kawaida. The mama who makes her chapati out there na maharagwe is still doing it, although she admitted that the number of customers has reduced. But like I think sita, she was using mfuko mbili now because wateja wamepungua, but her business was still going on. That's in that aspect. But now the bigger hotels, and Yvonne, you spoke to I think the official of their body, and they explained about how expensive it would be for them to be able to reopen. Ronaldo Cafe, the owner there, was talking about how I think it costs 10,000 shillings to test one waiter. And then we have all these factors. Would you test them every single day? Wakikuja kazini asubuhi kabla waanze kazi. You may test me now. I don't have it, but tomorrow morning I may somehow contract it.
I'm sure we'll have more conversations on that when we talk about the restaurants. But Linus has been itching to say something.
Yes, I just wanted to jump in on the issue of Mama Mboga and the restrictions. Because really, which is why we need to audit the first 21 days and the restrictions. Where have they been applied? They've really been applied just at a segment of our economy. It's mainly on the formal sector. It's mainly on the formal corporations, companies. That is where these restrictions have been applied. Because when you look at the informal sector, life has gone on normally in abnormal times. So if the infections are happening in Kawangware, they're happening because nothing changed except for the reporting time for the evening. Everybody's going back home at 7 p.m. That's okay. But in terms of how people are conducting their businesses, they are carrying on with their own lives during the day, it's business as usual in the informal sector. Nothing has changed. You drive through any of these markets, open air markets, life is normal. There are no masks. There's no 1.5 meter social distancing. Everything is operating as if COVID doesn't exist, which is why really these restrictions, the government needs to retreat and say, how are we applying them? Because it's not enough to lock the roads, shut the roads in the evening and send people back home. Can you also do something during the day that will make sure that the opportunity to spread the virus is limited? Because that's not happening.
Yeah, I know you want to take a break. Just to emphasize what you were talking about, the differences, take a drive along Wayaki Way, the Westland side, and along the highway. People are practicing social distancing. Even the ones who are running, they have their masks on. On the other side of Wayaki Way, inside Udhiru, Kangemi,
all is normal.
Day and night. Yeah.
All right, so we are taking a short break. When we come back, we'll be talking about the restaurants. They are supposed to be reopening. Why restaurants? And some of the measures that have been demanded of them, and why a lot of them think it might not be time for lunch just yet.